This video is to introduce you to the incident reporting and management of incidents within East Sussex Healthcare NHS Trust. At East Sussex Healthcare, we constantly look to improve our services and the care that we provide to our patients. We also want our staff to work in a safe environment and to enjoy their work and to feel valued. By encouraging our staff to report areas of concern and incident forms about when things perhaps don't go so well, we hope to take speedy action which will prevent harm from occurring in the future.
How should you report an incident? We use an electronic system called Datix Web to report incidents, near misses and concerns. This involves completing an easy-to-use form. Why do we want you to report incidents and concerns? To learn lessons from things that don't go so well. Reviewing these reports enables us to focus on the relevant improvements we should be making to services and areas of patient care. Reporting provides an accurate account of what could or has happened. The Trust benefits and learns from data comparison and benchmarking reports which are available from the Datix system. Tracking of trends and identification of themes of any areas of concern are an integral part of our divisional and trust governance processes. The National Reporting and Learning System, which is owned by NHS England and Improvements, collects information about all patient safety incidents and concerns at a national level from all NHS trusts and provides the NHS with benchmarking information and safety alerts where trends or themes have been identified and action is required. There are some legal requirements. To record information, for example, for use in compensation claims, complaints, coroner's inquests, or for health and safety executive investigations.
Access to Datix Web. Anyone who has access to our IT systems and has an ESHT user login can report an incident without having to log into Datix Web separately. The incident report form, called a Diff1, is accessed from an icon on the desktop of all Trust PCs or via a link on the extranet found under Incidents, Datix or Risk Management.
Some tips on how to complete the incident reporting form. At the top of the form there are some notes which will explain how some of the fields that you will see on the form actually work. So if you're new to Datix Web, it may be beneficial for you to read through the notes before you start to complete the form. The form has a security feature built in which prevents the form from remaining visible on screen if the reporter is called away. After 20 minutes of inactivity, the form will time out. To prevent this from happening too often, it may be helpful if you have some information with you before you start to complete the form. Check that you have the correct name of the patient or member of staff that was affected by the incident. Make sure that the spelling of both the forename and surname is correct. You will also need the date of birth and either hospital or NHS number of the patient affected. It would also be useful to have a list of the names of any staff that were involved in the incident, for example, any witnesses. Identify the division, specialty and department that the incident happened in, if that is different to the area you are working for. It would also be helpful for you to check which manager you need to submit your form to, and remember to check this whenever you change wards or departments.
The incident description field only has the capacity for typing 500 characters, so keep your description concise but clear as to what you're reporting. It might be helpful to begin with a sentence such as medication administration error. Do not type patient or staff names into the description box. This may compromise confidentiality, so there is a special area for you to do this safely further on in the form. Try to keep to the facts and avoid using abbreviations wherever possible, as many of these may have more than one meaning. Also avoid using any local jargon which may not be recognised outside of the organisation, for example, names of meetings or committees. Decide if the incident has caused harm or not, and whether this was a near miss. Depending on your selection, you can then decide on the severity of any actual harm. Severity 1. No harm. A near miss or concern that has not yet caused harm, or an incident which happened but resulted in no harm. Severity 2. Minor harm. An incident resulting in minor injury such as bruising or lacerations which require short-term treatment such as first aid. Severity 3. Moderate harm. An incident resulting in harm requiring additional interventions such as further surgery or readmission to hospital. Severity 4. Major. An incident resulting in harm that will result in longer-term disability or care needs. Severity 5. Catastrophic. An incident resulting in death which is directly attributable to the incident or to care provided by the Trust. There are a few trigger questions to answer, all of which will send out email notifications to relevant specialist staff to enable them to review the forms quickly and take immediate action should this be necessary. Enter your name and contact details so that we can speak to you if we need further information. Leave your nhs.net email address so that you can receive feedback to the incident form. Only nhs.net emails are acceptable. Submit the form to your immediate line manager whenever possible. If their name does not appear in the list, you should submit the form to an alternative manager in the specialty or department that you are working in currently. You will receive an email providing you with the web number of the form and confirming that the form has successfully been submitted. The line manager will also receive an email requesting them to review the form within 5 working days.
Management of incident forms. Once the investigation and feedback has been completed and updated on Datix web, it will then be closed by the handler. Severity 1 or 2 forms which represent near miss, no harm or minor incidents are reviewed locally by the line manager, now referred to as handler, with the assistance of any relevant staff. Feedback is then sent out to the reporter. The usual time frame is between 1 and 25 working days from the reporting date. Higher severity incident forms are reviewed by the Trust's weekly Patient Safety Summit, which will determine the type of investigation that is required, and they will assign a lead investigator. The severity level determines what type of investigation is carried out on each form. Unless the weekly Patient Safety Summit agree that the form can be downgraded, it will then undergo a root cause analysis investigation. These investigations can only be closed once root causes, lessons learned, recommendations and action plans have been identified and implemented. They are approved by the divisional risk and governance groups before closure occurs. This may take a while longer, and it is normal not to receive feedback for several months, especially if reported as a serious incident. Any high-severity staff incidents will be reviewed by the Trust Health and Safety team, who will work with the handler to identify any learning or to comply with any reporting requirements. Ongoing management may involve HR or occupational health for follow-up of staff health and well-being.
Feedback on the incidents that you report. Feedback is generated automatically by the Datix system, and it is supplied to you by the handler and the investigators of the incident. The success and timescale of this is dependent on several factors. You must provide a correct nhs.net email address when you submit your form. When you receive your feedback depends on the amount of time that it takes to complete the investigation and to get the form closed. Higher severity forms may take longer to complete, and it may take longer to obtain closure of the root cause analysis investigation and final report. It is the responsibility of line managers and of the handlers of the incident forms to ensure that their staff receive appropriate feedback, no matter what the severity is and what type of investigation is carried out. When you receive your feedback, if you are not happy with the content or if you are unhappy with the delay in receiving feedback, it is perfectly acceptable for you to go to your line manager and ask them to provide you with interim feedback. It is not necessary to wait for the automated email from Datix Web.
Lessons learned. All divisions review their incidents, identifying trends, themes and lessons learned. Severity 3, 4 or 5 incidents are all monitored through divisional risk and governance groups following discussion at the weekly Patient Safety Summit. The Datix team produces a quarterly newsletter called You Said We Did, which provides information from the Datix Web Incident Reporting module. It provides examples of some of the incidents that have occurred, the lessons learned, and recommendations and action plans that we have implemented as a result. The National Reporting and Learning System may issue safety alerts providing guidance to the NHS regarding patient safety concerns.